Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, doctor. How you doing?
Hello, Louise. Very, very well. How are you, my dear?
I'm doing great. We're here with Dr. Zahra Figueredo from Stem Cell Healing Institute, and we are doing this podcast in this lovely afternoon here in Guatemala. So, doctor, we do have an interesting topic today, which is degenerative arthritis. Um, can you explain how the term degenerative arthritis, because we think it's something irreversible, right? Because of the term degenerative. Can stem cells actually help to change that?
Yes. In a simple answer, yes. What stem cells? We've talked about this in the past, and it's important for listeners and viewers to understand that stem cells help with the regeneration of tissue. In this case, when we are talking about degenerative arthritis or osteoarthritis, so both go hand in hand, we are talking about a degradation or a degeneration of cartilage. That can be in the joints of the knee. Usually it is in the joint. It could be the knees, it can be elbows, it can be ankles, it can be shoulders, rotator cuff injuries, even the jaws with TMJ. So various different joints, hands. So we're talking about a degeneration of the cartilage of the joints. And so absolutely stem cells can help reverse the degeneration by building the cartilage back up and even the bone that the cartilage is attached to.
So the first thing that usually comes to mind when you talk about arthritis is someone of old age, an old person. Is that the case, doctor?
No, Luis, that's a really good point because yes, we often think of osteoarthritis or degenerative arthritis, and it's synonymous with old age, but not necessarily, as you said. We have sports injuries that are related to osteoarthritis and degenerative arthritis. Even just you don't have to be an athlete or anything even related to sports. It could just be normal wear and tear. It can be an avid runner. It can be someone that walks a lot or high impact activities or exercises or sports. So various different reasons, or also repetitive motions and repetitive use of a certain body part. A lot of times we see even cashiers who are constantly doing this all day long with degeneration in their hips and fingers, the joints in their fingers. So repetitive motions, high impact motions, sports injuries, old age, all related to degenerative and osteoarthritis.
There are different types of arthritis, right, doctor? Can you explain the different types of arthritis?
Yes, there's often a confusion between osteo or degenerative arthritis versus rheumatoid arthritis. Now, what is the major difference? First of all, the similarities are that there is a degeneration of the cartilage in both, absolutely, and the method of deployment of the stem cells is very similar in both. However, with rheumatoid arthritis, it is an autoimmune condition where there are antibodies attacking, created from the immune system of our bodies, attacking the cartilage. So in that case, we have to address the stem cell of the deployment in two different ways. In both, we will do local injections right into the joint of the stem cells. In the case of rheumatoid arthritis, we have to also address the autoimmunity, which means that we will also deploy stem cells in different ways, and that would be systemically into the blood as well, and into the inguinal lymph nodes to help modulate and shut off the autoimmunity in the immune system. So there are similarities, but major differences as well.
And for people that suffer arthritis, I believe weather is a big issue, right? I mean, if it's
Mhm.
cold,
Yes, we tend to see in the cold weather that achiness and that the deep achiness and stiffness that tends to happen in cold weather, and so we all and also humidity. So it's all very often something that we need to address with our patients. Hot and cold versus hot and cold therapy versus even the climate. Sometimes we can't control the climate. So we have to do that in our own internal environment.
can you go deeper in how you administer these stem cells locally? I'm just picturing this an injection into the joints. Is that correct?
Yes, Louise, it's very important to understand that we don't have much of a blood supply in our joints, be it the knees, the fingers of the joints of the fingers, the the rotator cuff, the ankles. So joints themselves have a very little blood supply. So putting the stem cells systemically as an infusion into the blood, like an IV, won't do us much good in the joints. So we absolutely do need to do local injections right into the joints in order to get the stem cells right where they need to be, right at the cartilage.
So I know you mentioned that anyone can suffer arthritis, but is this age related or can happen at any age?
Yes, it can happen at any age. It can
Okay.
happen. I mean, I have a 14-year-old patient who's a cheerleader, and she's the one that's the jumper, and she's the one that they always carry up on the pyramid, and she jumps from I don't know how many feet, and so 14-year-old that has cartilage damage already. So we're looking to treat her, and so just that's just a very simple example that this can happen at any age. And then of course in the 70s and 80s, we treat a lot of older patients as well, just from normal wear and tear and lifestyle, lifestyle which that caused degeneration and lifestyle that didn't address prevention. So, and that's so important in the way that we do this is we address prevention and maintenance as well.
And I do have a great example because I remember this video that we did with Mona, one of your patients. Can you give us a little bit of that story?
That's right. Mona and Bob, they're famous with us here at the Stem Cell Healing Institute, just with their results. Yes, Mona, we've done her knees, we've done also her fingers, we've done IV deployment of stem cells. She is 84 now. I first met her when she was 80, and we did the stem cell treatment, and soon after her treatment, she was doing the canopy, which is quite phenomenal, and she is just thriving right now, as well as Bob. Bob, we did his knees, his back, his neck, and he's hiking. I just received a text from him the other day that he's taking long hikes and just enjoying life, which is the key. It's about quality of life. And so
And dancing again.
and dancing again. We're really happy to report that. Absolutely.
Yeah. So, in this case, can this treatment be done in the United States
No, that's a good
or
question, Luis.
Canada?
Thank you. Yes, in North America, these types of treatments are restricted. They are not allowed. The key is that in terms of stem cell treatment, so there is a version of stem cells available in the US, not in Canada, but in the US, yes. However, it's so restricted in that the stem cells can't be grown to get higher numbers for a greater impact on disease and degeneration. Number one, the stem cells cannot be combined with growth factors or anything that would be considered an unapproved drug by FDA standards. The stem cells cannot be taken from any other source but the patient's own body. And in a lot of cases, taking stem cells from another source can be more effective depending on the disease and what's being treated. So these are all major restrictions that make the stem cell treatment very, very, uh, it affects the results and very prohibitive. So this is the reason that we do this in Guatemala. And what allows us also to do this so effectively and so allow this treatment to get to the greater public is that being in Guatemala not only allows us to do this great extent of cutting edge treatments, but also we can keep the prices ethical and being outside of the US. And so that allows the stem cells to be more widely available for patients.
And this treatment, would it last how long, doctor, in case the patient comes?
This treatment, we have patients stay for a minimum of 7 days, maximum of about 10 days, but more often than not, all we need the patient in Guatemala for is for 7 days, and we get everything accomplished in that time.
Awesome. And Guatemala, it's well, I'm not gonna talk about my own country or my own city, but can you give us your own opinion as a Canadian about the city?
Yes, it is. It is phenomenal. It's quite diverse. It's a beautiful culture. It's a very touristic place, actually. Even to, I never, before I moved to Guatemala, I had no idea how beautiful, how the resources, the landmarks. There are coffee farms and volcanoes and just this natural beauty that it is very much overlooked as a destination place, and just a gorgeous country to visit for treatment, but of course to vacate as well. So it's a lot to be said for Guatemala.
And I suppose being in Guatemala, the price will be more accessible, right?
That's right. Yes, and then that's what allows us with the being a developing country, we can a lot of our patients can afford the luxury of a stem cell treatment, which in a lot of other countries it's inaccessible.
And one of the things that makes us or makes you unique in this type of field is that patients don't have to come. You always give that example of the revolving door. They don't have to come for more than one session, right?
That's right.
Well, that is the goal, right?
That's the goal. And in most cases, in a great percent of cases, we get the results we want and that we're striving for in one treatment. It's very rare that a patient will have to come back for another treatment, especially with degenerative and osteoarthritis. Very rare. And I always tell the patients, give it time. Let's do everything right. We try to do everything we possibly can right. A minimum of 3 months is what I tell patients to start seeing a change, and it can be 3 to 6 months. And I always tell patients, let's wait it out before we make any judgments. And more often than not, actually, in all of our cases, our patients have seen very good results, and we've been very pleased with that. And I'm happy to say that. Over 90% of our patients are just happy patients and referrals. So that's been a big blessing for us.
And do you accommodate also all the patients? Do you provide any accommodations?
Yes. So when patients decide on treatment, our comprehensive treatment package that also involves a total detox program, growth hormone therapy, oxygen therapy, stem cell enhancement formulas, and then, of course, the whole stem cell treatment itself. It also includes 7 days, 7 or 10 days accommodations, whatever is decided upon, depending on the degree of treatment, as well as a personal driver to that includes airport transfers as well as to and from appointments and any errands that need to be done with the patients or for the patients. That includes it all.
And I'm going to ask you this last question, doctor. It is important for people to know, and I always recommend for them to do their own research. But in this case, there are some type of stem cells that we do not use. And can you explain what stem cell would you use in the case of arthritis, and what type of stem cells we definitely don't use?
Yes, let's start with the stem cells that we don't use. We do not use embryonic stem cells at all. Embryonic is a very primitive cell line that can differentiate and go on to grow uncontrollably. Okay, that's theoretically, and they can grow into tumors or cancers. They have not been deemed safe. And also there's the controversy of where the stem cells are coming from. So we do not use embryonic stem cells at all. We do use, depending on, again, what we're treating, we can use bone marrow derived stem cells, adipose tissue derived stem cells. More often than not, it'll be bone marrow and not so much adipose derived. I can go into that in another podcast. But the numbers are really important. And so that's one of the reasons. And we have a proprietary method of growing the stem cells and producing brand new non-toxic stem cells in the bone marrow within 3 days, incubating them in vivo without having to do that in a lab. So for that reason, we prefer to do bone marrow versus adipose derived, and sometimes even more so than umbilical cord. However, if a patient wants umbilical cord cells, we do use them. However, bone marrow is our method of choice, and we can go into why that is in another podcast, as well as endometrial derived stem cells, which are from a healthy young uterus, female human uterus. And so, and we can go into reasons as to why endometrial also versus other types of stem cells. So those are the types of stem cells that we use at the Stem Cell Healing Institute.
Thank you, doctor. I don't know if you want to add something else to this podcast.
I think we've covered a lot of ground. I think we've, unless we have any specific patients, questions from prospective patients, listeners, and viewers, they can direct them directly to us at the Stem Cell Healing Institute.
Yeah, in case you want to ask doctor a question, or if in case you want to know more about stem cells, you can send us an email to info@stemcellhealinginstitute.com. And also you can visit our website, stemcellhealinginstitute.com. And by the end of the podcast, you will find all the social media of our institute. Doctor, you have a great day.
Thank you, Luis. You as well.
Bye-bye.
Bye-bye.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.